Hello and welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin. And as always, I'm really excited that you're here. And I'm really excited to be here with Steve Floe, another Minnesota innovative company, even though we met at Dentech in Boston a few years ago. But I've just been really impressed with what Voyager is doing. And I'm really excited, not just what we're going to talk about, but what you're doing for the dental industry, for dental patients, for access to care. So, as CEO of Voyager Dental, which does AI restoration design. Um, how do you see what the impact that you're bringing to the dental population?
Yeah, well, thanks, Brian, for that question. I think, importantly, our tool, which enables clinical efficiency and standardization of care outcomes, um, helps us see and treat more underserved populations who need care, frankly, who struggle with access to care. And I think that's probably the biggest impact is we can deliver a high quality result, really to any patient population.
Well, when I was practicing dentistry, I stopped doing dentures, right?
And that's very common experience.
And having worked with Voyager now and seeing what you're doing, I think it's very important that for the dentists out there that are maybe frustrated with how long it's taking, maybe they don't feel like their skills are up to speed, that, I mean, my words would be that the way it's been done is broken. So you'd have to be like a master clinician to figure out how to get this done. But I think that Voyager actually addresses these issues. Do you want to talk about that a little
Yeah,
bit?
no, I appreciate that. Again, that's absolutely what we're here for. So this platform was built from the ground up, really with some world-class software folks from the medical industry, but also from dental backgrounds. And I think your experience as a clinician is what we're trying to solve for. In part because back to that access to care. Look, if you can't make the math work, how are you going to provide the care, right? And so that's really what we want to change. And I think I've heard that just over and over and over again in so many different settings, whether it be DSO or private practice or rural care, just how frustrating it can be. And it was I think a chief clinical officer, a rather large DSO, who, we said, what's your average there? Is it 5 visits for a denture patient? And he jokingly, but not really jokingly, said, well, it feels like it's about 20. Because there's all those non-revenue generating follow-up visits, which related to adjustments and things. How do we not get it right the first time? And I think that's really what we're working to solve for. So
Yeah, honestly, I don't think it's abnormal to say 20 because it's almost like let's face it, what's the traditional way of making dentures? Taking some plastic, putting it in wax, like investing it, and it's not going to stay where you put it. And also, it's kind of arbitrary where we're placing teeth to a large degree.
it really also brings up another good point, which is there is this technician crisis, this labor crisis of highly qualified, skilled people. And we're sort of in this challenge, this conundrum. You can get a perfect denture from a world-class technician, but there just aren't enough of them to go around. And those folks who are really good are charging a lot. And sometimes makes it hard for the dentist, especially after all those visits, to make the math work, like we talked about. And what we're all hopefully working towards is making it work for the patient. And again, patient experience. They want it to fit right. They want it to look good, but they also they're happy to be in and out of the office with the end result.
Well, and Voyager just hasn't just created the AI technology that has a more perfect occlusion and perfect fit, but uh, you know, 2 to 3 visits is average for a Voyager denture patient,
Oh,
right? But you kind of meet dentists like myself that frankly aren't that comfortable doing dentures now by educating them. So can you talk a little bit about that too?
yeah, 100%. I think it's I think just our effort to approach the problem holistically and recognizing that not everyone's familiar with the digital workflow. How can we support them where they are? In fact, maybe some people have decided not to provide denture care in their offices because of their experiences with it. So we really want hands-on experience. We're aiming to do 150 CE events this year. We'll be reaching out to your state associations. We've been really fortunate to have some training support that we've sought from the ADA and ADA Foresight, and we'll be expanding upon that this year. But our goal is to have sort of boots on the ground, clinicians speaking to clinicians, world-class CDTs available as you need them to answer questions, but also just kind of a simple blueprint. Here's what you need to do to succeed.
Yeah, I mean, you mentioned it. We're at ADA SmileCon, and if you look at all the great companies that are here today exhibiting, you know, we're in the innovation hub for ADA Foresight, and lots of great things. But if you think of the parts of dentistry which have not been positively influenced by the digital dental wave that's been going on for the last 25 years, I think high on that list of procedures that there's the ability to fundamentally change in a positive way is dentures. And I think and you are doing that in the most profound way. So appreciate what you're doing for that population base, which is large and needs that care. So.
Yeah, thanks for that. And I would just add that, you know, it's the technology, it's the software, it's the approach, it's the tools, it's the people, it's the in-office process. But also we're working, you know, with the insurance providers. We're working with the ADA to hopefully make some differences, make some dents in the coding and the reimbursement. I'm really thinking about the picture holistically. And then finally wanted to add, a big piece of this really ties into the oral physical health connection. And there's many of these populations that are actually engaged in value-based programs, and those programs aren't necessarily paying attention to what's going on to the dental side of the equation. And we think that's a mistake, and we'll be advocating and really sifting through the population health data to help tell the story. And then similarly, on the clinical side, thanks to Toothapps and the tools that they provide, we have leveraged their interoperability solutions to help tell the story for the clinician, just how much difference it's made for their practices. So
yeah, it's a key point, because I mean, although I think that, you know, the Voyager denturist, maybe I say it that way, well, you know, it's one of those things where you'll see after you get the first couple you do, the dramatic positive change for your practice, for your revenue, but then tracking it over time.
yeah, just seeing it
massive.
And I think that's a tool that's going to be huge for all dentistry. And it's not Voyager's tool, really just encouraged and supported by us. It's you know, something Toothapps has enabled, and it's I think really important, just applicable to all parts of dentistry.
Well, thanks for that. Well, so I know we're going to put a special offer based on the ADA SmileCon event around this presentation. So make sure to look for that if you're listening to the podcast or watching this on YouTube. But where can people go to find more information?
Yeah, just go to voyager.dental, and we'll have some of the details of whether you're a SmileCon attendee or not, how we can support you. One of the things we have is a free denture that we're offering as part of the program. But probably more importantly is the sort of hands-on assistance and the training and the tools to succeed consistently. But yeah, we do have a promotion out of this event. So.
Well, great. Well, thank you, Steve. Thanks for being here.
Appreciate it. Thank you.
Thank you.